everyone. I'm Dr. Pamela Maragliano-Muniz, Editorial Director for Pearls for Your Practice, part of the Product Navigator newsletter at DentistryIQ.com. We're here day 4 at IDS, and as you can see, the exhibit halls are still booming. I'm here at the GC booth here with Stephen Haynes. Thank you for having me.
Thank you, Pam.
And we're here to talk about this amazing contribution to preventive dentistry, the MI Handbook. So before we get into the handbook, let's talk about minimally invasive dentistry, or the concept of MI, because there's a lot of interpretation for what MI actually is. Some people think it's for pediatric dentists or the prevention of tooth decay, or sometimes just simply small tooth preparations. Can you tell me what GC's philosophy is for MI?
So minimal intervention is a practice philosophy that encompasses all aspects, if you like, of a medical model. So we're looking at identification being important, we're looking at prevention being important, we're looking at the cavity preparation as part of it, but it's an overall philosophy that's focused in on the patient.
I would have to agree. It's important that we can't just fix teeth anymore. We have to really work within the patient's oral environment, their medical history, what type of medications they're on, so that we can not only treat the disease, but also prevent more disease later on.
Yeah.
Now, I got a chance to take a look at this handbook ahead of time, and this was created by GC Europe, a lot of doctors that are really interested in research and the minimally invasive approach to care. Can you tell us a little bit about what's in this handbook?
Well, the group that put it together is an advisory board that covers private practitioners as well as academics, so it's a good mix. And what they looked at is not only the concept of minimal intervention as a big philosophy, but looking at how we might apply that across different age groups and situations. And so MI early care is identifying what's important in a primary care or pediatric situation. And then MI active care is looking at people like you and me in a normal adult lifestyle situation, but MI Care Plus is recognizing the aging population and the special needs that come into play in certain situations, which is also things like pregnancy or special care patients. But the big one is geriatric care and our aging population.
Wow. So I can tell you that there's a lot of confusion about how to implement an MI philosophy in the practice. There's so many materials out there, so much science, but this is a huge contribution because this really, in this small handbook, it's really concise, will teach us how to bring this into our practice and use this in our everyday lives.
Yeah.
That's incredible. So does it make recommendation, it allows us to identify risk factors, classify the patient into which category they fall into, and then also will provide recommendations to minimize their risk of disease? Doesn't get much better than that. Now, I know this is available. This was launched here at IDS in Germany just this week. Is this something that will be available in the United States?
Yes, it will be.
And do you know how much this is going to cost our viewers in the United States?
No, I don't know how much it's going to cost, but I would suspect it'll be very reasonable.
I heard it's more than reasonable, so this is something that I cannot wait to see in the United States. Thank you so much for your time, and thank you for having me, and congratulations on this incredible contribution.
Thank you, Pam.
Thank you.